So guys, hello and welcome. Let's begin our topic, that is hemophilia. So I've just for the ease of understanding and remembering, I have divided the topic into three divisions, and first part being the physiology, second part being the pathology, and the third part being the medicine part. So in physiology, we'll discuss about what is the process of hemostasis and how things go on when a bleeding starts in your body. In pathology part, we're going to discuss about the tests which we use for evaluation of this condition to confirm the diagnosis, as well as the defects that could occur in your body which can lead to bleeding like manifestations. Okay. And in the medicine part, finally, we'll discuss about the definition of the condition hemophilia, its clinical features, investigations, and management. So let's begin with the physiological part. First, I would like you guys to be aware of what happens physiologically in a normal body when bleeding manifests. So the first step that occurs in the chain of events to cause hemostasis is vasoconstriction. Vasoconstriction refers to the vascular spasm, which is an attempt from the body to reduce the blood supply to that area of bleed. The second step which occurs is platelet plaque formation. Now this here you need to note is formed by platelets itself, and this is sort of temporary platelet plaque formation, and permanent platelet plaque formation is the third step, which is aka blood clotting. Blood clotting is done by platelets along with fibrin. So that's how it works. And now we're going to discuss about what are these clotting factors, or what is this fibrin and how it gets activated to cause this permanent platelet plaque formation. Okay, so you might be very well aware of these term called clotting factors, and there are total 12 clotting factors which are named from 1, 2, 3, 4, 5, not 6, 7, 8, 9, 10, 11, 12 and 13. So that's how they're named, and that's how it works. I have a mnemonic for you guys just in case you're not able to remember these tricky names, and the mnemonic is freshers party tonight, come let's sing and call seniors, please have fun. So these 3-word sentences, there are total 4 sentences which consist of 3 words, and the first alphabet of each of them is like F stands for fibrinogen, P stands for prothrombin. That's how it works. So T for tissue factor, C for calcium, L for labile factor, S for stable factor, A for anti-hemophilic factor, C for Christmas factor, S for Stewart power factor, P for plasma thromboplastin antecedent, and H for Hageman factor, F for fibrin stabilizing factor. So having discussed the clotting factors and the names, now I'd like to take you guys to the steps of the blood clot formation or the permanent platelet plaque formation. So what is the first step is formation of prothrombin activator. Now how does this proceed? Like prothrombin activator is the common it's like this prothrombin, as I said you, the second factor, this needs to be activated. Okay, now there are 2 pathways for causing this step, that is intrinsic pathway and extrinsic pathway, and both of them will lead to prothrombin activator, and then from prothrombin activator they'll cause conversion of prothrombin to thrombin, and then fibrinogen to fibrin. So these 2 pathways, that is intrinsic pathway and the extrinsic pathway. Let's begin with the smaller one, which is the extrinsic pathway, for the ease of understanding. Now whenever some tissue trauma occurs in your body, your third clotting factor will go and activate the 7th clotting factor, and they both in turn will activate your 10th clotting factor along with the aid of calcium and phospholipid. So this is how the first and the foremost main task is achieved, that is activation of factor 10 via activation of factor 3 and factor 7. Yeah. So now come to the intrinsic pathway, which is quite longer but easier. So what happens is the factor 12 from your body gets activated on trauma, and it in turn activates the factor 11, which will in turn activate the factor 9, and factor 8 along with factor 9 together will activate your factor 10. So basically what is happening is activation of factor 10 here and here as well. So but the pathways are different, intrinsic and extrinsic as they're named. Now this is the first step. Now what will happen is this factor 10 along with factor 5 from your both the sides will along with factor 5 activate the prothrombin to thrombin. So that's the second step. First we said formation of prothrombin activator and then prothrombin to thrombin. Now comes to the third and the most final step, which is conversion of fibrinogen to fibrin. Okay, so that is aided by the 13th factor, that is also known as fibrin stabilizing factor, due to the fact that it stabilizes the fibrin. Now I am quite sure you guys might be very well versed with the physiological part. Moving towards the pathology. So when we say pathology, there's some problem in the normal part, right? So let's see how it goes and what actually is the problem. So yeah, talking about defect in hemostasis. So defect in hemostasis could result as defects in two different plugs, that is defect in the primary plug or defect in the secondary or the permanent platelet plug. Now as you know, primary platelet plug is formed only by platelets, and so any defect in the platelets could lead to a problem with this part, and defect in platelets could be quantitative or qualitative. Quantitative defect or decrease in platelet count is known as thrombocytopenia, and qualitative defect is platelet function defects, which is out of the scope of today's discussion. All I'd like to say is any defect in the primary platelet plug formation will result in mild and superficial bleeds. Okay, so petechiae, purpura, thrombosis are result of defect in primary platelet plug formation. Whereas if we talk about today's topic, hemophilia, it is a defect in the secondary platelet plug formation, which occurs due to defect in fibrin activation, and any such defect is known as hemophilia. Hemophilia A stands specifically for the deficiency in factor 8, B stands for deficiency in factor 9, and hemophilia C is for deficiency of factor 11. So there are other factors such as von Willebrand factor, which help to stabilize your factor 8. So any deficiency in the von Willebrand factor will also cause similar manifestations to that of hemophilia A. And just for information, clotting factors such as 2, 7, 9 and 10 are dependent on vitamin K for their synthesis. So any vitamin K deficiency can also lead to hemorrhagic manifestations. Moving ahead with the tests for evaluation of this condition. Okay, so guys, we're now discussing about the tests for evaluation of this condition, and the tests which available with us are BT, which is bleeding time, normally 2 to 9 minutes. So bleeding time refers to the time taken for the bleeding to stop, which means that it's measuring the action of platelets plus von Willebrand factor, because von Willebrand factor is also required in platelet adhesion. Second is clotting time. So this BT and CT are clinically not much used nowadays, but theoretically we should be aware of them. And so the clotting time is normally 4 to 11 minutes, and it is the time taken for the clot formation. That is, it is a measure of the function of clotting factors plus the von Willebrand factor. And now we're talking about the platelet count, which is normal in cases of hemophilia because there's no platelet defect or deficiency. Talking about the third test, or the fourth test, that is APTT, that is activated partial thromboplastin time, which is referred to time taken for citrated plasma to clot in the presence of kaolin, phospholipids and calcium. So basically these three things are required for activation of intrinsic pathway, and therefore this test is a measure of intrinsic pathway plus the common pathway, which means that if in case APTT is increased from its normal 30 to 40 second duration, then you can suspect a deficiency or a problem with the factors 12, 11, 9 and 8 plus the factors of common pathway. And coming towards PT or the prothrombin time refers to the time taken for by the citrated blood to clot after the addition of calcium and thromboplastin factor 3. So basically it's 11 to 16 seconds in general, and in case you find this factor, this time, this test to be taking longer time than normal, you can suspect a deficiency in the factors of extrinsic pathway or the common pathway, that is factor 7 or factor 1, 2, 5 and 10. So now we're going to talk about the whole medicine aspect of hemophilia, which is what is hemophilia? So hemophilia is an X-linked recessive disorder, which means there are higher chances of these disease being there in males because it's X-linked and recessive. So there's it is an X-linked recessive disorder which is causing a reduction in amount of which is characterized by reduction in amount of the factor 8 in case of hemophilia A, and factor 9 in case of hemophilia B, and factor 11 in case of hemophilia C. So hemophilia A is the most common one of them, and now I'd like to talk to you about certain clinical features of how hemophilia A is gonna present. So clinical features are gonna be hemorrhage, which is secondary to trauma in mild cases. So which cases are mild cases? Patients in whom 6 to 30% of normal factor 8 level is present in the body, they are mild. From patients in whom 1 to 5% of normal activity is found are moderate, and those with less than 1% of normal are categorized as severe clotting factor 8 deficiency. And now they're going to manifest as, the severe cases are going to manifest as spontaneous hemorrhages and hemarthrosis, and petechiae is not seen in hemophilia, which you should be aware of. It's visible in platelet deficiencies and platelet defects. So basically all problems which cause difficulty in the formation of primary platelet plug formation, but here the difficulty is in secondary platelet plug formation. Talking about hemarthrosis, it refers to bleeding in large joints such as knee, hip, elbow on minor trauma, or spontaneous bleeds may be seen. Which will present to you as hot, swollen, tender joints with restricted movements, and recurrent bleeding can cause crippling deformities and atrophy of muscles around the joint due to restricted movement of the joint. And psoas muscle could show psoas hematoma and calf hematoma in calf muscles. Easy bruising can lead to cerebral hemorrhages. Hematuria and ureteric colic are present due to passage of frequent and recurrent passage of blood clots. Investigations that we're gonna do are BT, which is going to be normal, CT or the clotting time, which is definitely going to be decreased. PT is going to be normal as it measures the extrinsic pathway, whereas here we have deficiency of factor 8, which is involved in the intrinsic pathway. So APTT is the one that's going to be increased. So I'm sorry, here the CT and the APTT are not going to be decreased, instead they're going to be increased. They'll take more time than normal. So the platelet counts are going to be normal, and the factor 8 assay should be done to get a confirmatory diagnosis and also assess the severity of disease in the patients. Now antenatal diagnosis can be done by chorionic villi sampling and amniocentesis, and management of these cases is first primarily the management of wounds by applying pressure bandages, management of hemarthrosis, if any, by elevating the limb and using analgesics, and replacement therapy is available for factor 8, which is recombinant factor A or plasma derived factor A. Now, plasma derived things always have a risk of transfusion transmitted infections with them, such as hepatitis B, HIV, and recombinant are always better relatively. Dose can be calculated, and they can be administered IV. And non-transfusion therapy in hemophilia is DDAVP, that is desmopressin, which causes a transient rise in the factor 3 activity by 3 to 5 times, and antifibrinolytic drugs such as tranexamic acid. Okay, so guys, I hope this video sort of adds value to your life and you're quite well aware of this concept of hemophilia. If it does, please consider subscribing my channel and liking the video and sharing it with your friends, cause it helps me and motivates me to keep going. Bye bye, see you again.